No more freckles. Freckles are small brown spots on the skin that usually appear in areas exposed to direct sunlight. In most cases, it's harmless. Dark spots are formed due to the overproduction of melanin, which is responsible for the color of skin and hair pigmentation, which causes dark spots to form. Overall, stimulation from ultraviolet UV radiation. Before we understand it in depth, we should first talk about pigmentation. What is pigmentation? Pigmentation may occur when the skin produces too much melanin, the pigment that discolors the skin, and doesn't metabolize it as quickly. This can make spots on the skin appear darker than the surrounding areas. Pigmentation is a common skin problem. Can occur in all skin types. There are many types and conditions of pigmentation, and not everyone may have the same pigmentation. Pigmentation actually describes the skin that looks darker. There may be several conditions. Small area, large area are affecting the entire body. Although usually black pigmentation is usually harmless, it generally does not affect life. But it is still necessary to pay attention to whether melanin deposition is caused by medical problems. How do you get freckles? Freckles develop due to sun exposure and sunburn. They can appear in anyone who is unable to protect themselves from UV rays. They appear on your face, the backs of your hands, and your upper body. This type is most common in people with lighter skin and lighter hair. Freckles are a genetic trait caused by uneven distribution of skin pigmentation. Freckles occur when there is a large amount of melanin underneath a spot on your skin. Freckles' main causes of sun exposure and genetic inheritance will fade with age, commonly seen on face, neck, chest and arms. Changes mainly appear in summer, lighter in winter, area 1 to 2 millimeters, although can be larger, appear irregular and pronounced, color red to light brown. Freckles are the type that most people consider to be common spots. The main cause of sunburn is mainly the result of sun exposure. Whether it fades with age, may increase and is difficult to disappear. Common on skin that is easily exposed to the sun, such as the face, hands, forearms, chest, back and legs. Changes do not change with the seasons. Area 2 millimeters or larger. Appearance usually noticeable, light yellow to dark brown in color. Sunspots are dark skin patches that develop in adulthood. This includes freckles, age spots and dark spots. About other types, melasma. This is another common skin problem, also known as butterfly spots, liver spots, pregnancy spots, commonly seen in areas frequently exposed to the sun, mainly the forehead, cheeks, nose and upper lip. It causes brown or gray-brown patches on the skin, usually on the face. It is more common in women. Melasma can be triggered by hormones. It is also very common during pregnancy and will slowly subside after the pregnancy is over. Melasma is non-cancerous and is more of a medical aesthetic problem. Birthmarks. There are two main types, pigmented and vascular. Birthmarks can be flat or raised, large or small, and can come in a variety of colors and shades, such as tan, brown, purple, red, and light blue. Most birthmarks are harmless, but some may be health-related. Moles. Moles are often darker in color, although not necessarily related to sun exposure. However, like freckles, moles are more common in people with lighter skin. It is made up of an excess of pigment-forming cells and has a greater than average supply of blood vessels. It usually appears at birth or shortly after birth. The color can range from brown to pink. Reference mark reminder reference mark. Although sunspots, freckles and other spots are mostly harmless, if there are any abnormalities, such as rapid proliferation, obvious changes in appearance, or abnormal appearance, a professional doctor should determine whether it is normal.